My dear students, I am Dr. Jayaprakash, Professor of Forensic Medicine. Now, let me talk on NEET PG 2023 discussion on recall questions in Forensic Medicine and Toxicology. Okay, totally there are 13 questions, maybe 1 or 2, 3 maybe overlap, but 10 minimum pure Forensic Medicine. Okay, number 1. En-masse dissection technique of autopsy where the organs removed from tongue to prostate refers to. Let me teach you 4 techniques of autopsy. Number 1. Lettuce technique. Lettuce technique. A lettuce technique, it is also known as en-masse technique or en-block dissection. En-masse technique or en-block technique or en-masse dissection or en-block dissection. And see the spelling. It is E-N-B-L-O-C, not B-L-O-C-K. Okay. Now, what do you mean by en-masse? En-masse means in a group, all together. All together. At the same time, meaning of en-block also same. All together or all at the same time. Okay. So, here, entire organs, right from the tongue till the rectum, everything removed as a single mass. And sometimes some book mention en-block as Gauss dissection. That's why I'm showing you the reference from Dr. Bernard Neet textbook of Forensic Medicine, where he has mentioned clearly en-block by a modified occurrence procedure, more accurately described as lettuce. That means lettuce is also known as en-masse dissection technique or en-block dissection technique. Again, I repeat, en-block is not Gauss technique as many Indian textbooks have given. Okay. Here, as I mentioned, oral, cervical, thoracic, abdominal and pelvic organs are removed as one large organ block, and it is commonly done in medical colleges to teach students. Look at this question. In lettuce technique of postmortem, as you know the answer, all the organs are removed as a large single block. En-masse removal of autopsy is called lettuce technique. En-block removal or at autopsy is called, again, the answer is lettuce. Okay. Now, as I mentioned, it is commonly done in medical college to teach both undergraduate as well as postgraduate students. Okay. Number 2, Gauss technique. Gauss technique of autopsy. Here, it is also known as block by block dissection. Block by block dissection. Generally, cervical and thoracic organs as one block, abdominal organs as one block, and urogenital system are removed as one block. Later, it depends on the pathologist. Say, for example, they want to remove hepatobiliary system as a block or urogenital system as a block. Here, all the organs are not removed as a single block. That's what is known as block by block dissection. Don't get confused between en-block dissection and block by block dissection. Okay. So, Gauss technique, cervical and thoracic organs, abdominal organs and urological system are removed as separate organ blocks. At autopsy, block by block dissection is known as Gauss technique. Gauss technique. At autopsy, en-block dissection means lettuce technique. I hope as of now you have cleared up all your doubts. Okay. Which among the following is the en-block method at autopsy? Lettuce. Lettuce. Number 3, workhorse. Workhorse technique of autopsy. Organs are removed one by one. Organ by organ removal, and this is most commonly done in India. Most common method adopted in India is workhorse technique. In workhorse technique, organs are removed one by one. Okay. Rokitansky technique, number 4. It is in situ dissection. In situ dissection. It is done in case of infected bodies or suspected infection cases. Okay. We don't want to expose ourselves too much with the dead body. We just open the cavities, major body cavities, then we just observe from outside. If at all you require a tissue, then only we remove that. That's all. Okay. In Rokitansky technique of postmortem, in situ dissection is done. In situ dissection is done. The autopsy technique used in case of infected or suspect infection cases is Rokitansky. Which of the following is correctly matched? Asked in Ames November 19. Already know the answer. Rokitansky in situ. Correct. Workhorse and mass. No, workhorse is organ by organ. Gons is block by block. Lentils is en block or en mass technique. And here I can tell you a mnemonic. Don't worry. So here the worry you make it Ori. VORI. GB lay. V workhorse. O organ by organ. R Rokitansky. I in situ. G gons. B block by block. L lentils en block or en mass. Okay. That is the first question. En mass dissection is lentils technique. Meantime, two questions asked from the same. The technique of autopsy used in case of infected body is already I discussed Rokitansky technique. Okay. Number 3. A laborer while walking under hot sun collapsed with loss of consciousness and brought to the emergency department. On examination, his body temperature was found to be 106 degree Fahrenheit. 106 degree Fahrenheit means almost more than 41 degrees centigrade. What is the least likely finding? What are the general effects of heat? General effects of heat are 3. Number 1, heat cramps, also known as minus cramps or Stoker's cramps or fireman's cramps. Here, the effect is due to the loss of salt and water from the body through the sweat. Loss of water and salt in the sweat. Here, persons suffer from cramps, but body temperature is usually normal. Body temperature is normal. Number 2, heat syncope or heat frustration or heat exhaustion or heat collapse. That is peripheral vascular collapse. Suddenly, person gets syncopal attack and he becomes unconscious. Again here, body temperature is usually normal or maybe slightly raised. Doesn't go up to 106 degrees Fahrenheit. Number 3, heat hyperparaxia or heat stroke. Heat stroke. Here, many times they ask question from heat stroke. I tell you the important points under heat stroke. Core body temperature increases above the level of 40.5 degrees centigrade, and this reference is as per Harrison's textbook. Number 1, core body temperature more than 40.5 degrees centigrade means almost 105 to 106 or above Fahrenheit. Skin hot and dry. There is absence of sweating. Most important point. Absence of sweating. Breathing is rapid, deep and small tie. BP. Initially there may be hypertension but followed by hypotension. Hypertension. What about heart rate? There is tachycardia. Heart rate is increased. Pupils are constricted. Pupils are constricted. Okay. Now, coming back to the question, body temperature found to be 106 degrees. That means it is heat stroke. Heat stroke, there is hypertension, there is tachycardia, there is hot skin, but sweating is absent. So, least likely finding is sweating. Okay. Number 4, section 314 of IPC deals with, all of you know very well, section 312 to 316 deals with miscarriage. Miscarriage in law, what we call abortion. In law, abortion is called as miscarriage, dealt under section 312, 313, 314, 315 and 316. Now, according to Williams aftertakes, abortion is defined as spontaneous or induced termination of pregnancy before fetal viability. But as per law, abortion or miscarriage means termination of pregnancy or expulsion of products of conception at any time before full term. Any time before full term. Okay. Now, what are the causes of miscarriage? It may be spontaneous or artificial. Spontaneous, you know, I have studied under obstetrics. Maybe natural or accidental. I don't want to talk in detail because all of you know that very well. And artificial means induced abortion. And it may be criminal abortion or justifiable abortion. If at all abortion is done as per the provisions of FMT Act, then it is justifiable. If the abortion is induced or committed or done without under the provisions of FMT Act, then it is criminal. Then it is criminal abortion. Criminal abortion may be done, number one, with the consent of the mother. If the criminal abortion is conducted with the consent of the mother, it is punishable under section 312 of IPC. Without the consent of the mother, punishable under section 313 of IPC. And while conducting abortion or as a complication of criminal abortion, if the mother dies, it is punishable under 314 of IPC. 314 of IPC. Okay. Section 312 to 316 deals with punishment for inducing criminal abortion. Now you know 312 with the consent, 313 without the consent, 314 death of the mother. What is 315? Act done with intent to prevent child being born alive or to cause it to die after birth. Any act, say for example, woman continuously hit on the abdomen with the intention of killing the child, that is 315. 316, causing death of quick unborn child by act amounting to culpable homicide. So for example, tomorrow one person assaults a pregnant woman with the intention of killing her or whatever it is. That time she aborts, then the person is punishable under 316 of Indian Penal Code. Now you got the answer. Section 314 of IPC deals with causing death of the mother by miscarriage or by abortion. Okay. Number 5. A dead body is brought to the mortuary. On external examination, rectal temperature was found to be 39 degrees centigrade. What is the probable cause? You know very well. When the person dies, normal body temperature is about 37.2 degrees centigrade, or roughly you can say 37 degrees centigrade. If the environment temperature is less than 37 degrees centigrade, once the person dies, body starts cooling. That is known as algor mortis. On an average 0.6 degree or 0.5 degrees centigrade, it cools per hour. Okay. But sometimes body temperature will be more than 37 or 37.2 degrees centigrade. It may rise by even 1 to 2 degrees centigrade, known as postmortem caloricity. The temperature of the body remains rise for the first 2 hours up to 1.5 to 2 degrees centigrade. That is known as postmortem caloricity. Normally 37 or 37.2 body temperature as given in the question, it may be 39 degrees centigrade. Now we should know what are the causes which give rise to rise in body temperature which is seen even after death. Number 1, disturbances in heat regulation. For example, as already mentioned, sunstroke or heat stroke, pontine hemorrhage. Pontine hemorrhage, where it gives rise to malignant hyperparaxia. Number 2, increased production of heat due to muscular activity like tetanus, stiffness, nux vomica, poisoning, or violent asphyxial death, very overactivity of the muscles. That also may give rise to postmortem caloricity. Number 3, in infections, excessive bacterial activity like septicemia, cholera, influenza, or any causes which give rise to fever, any infection which give rise to fever. Number 4, miscellaneous like alcohol poisoning, heroin, cocaine, carbon monoxide poisoning, high atmospheric temperature. If the atmospheric temperature 40 degree, instead of cooling, body temperature rises to attain the atmospheric temperature. Okay. Or maybe drug reactions and fat and air embolism. Now, come back to the question. Intra-abdominal hemorrhage, no. Septicemia. Corrosive poisoning, you don't get postmortem caloricity. Cyanide poisoning, you don't get postmortem caloricity. Okay. Number 6. A child has been brought to the police to the Department of Forensic Medicine. Examination revealed reddening around the anus with the tenderness during examination. Laboratory examination of anus swab by using picric acid reagent showed yellow needle-shaped crystals under microscope. This question repeatedly they ask. I think almost since last 2, 3, 4 years they are continuously asking about Barbieri's test. Anyway, look at these 4 pictures. This is microscopic appearance. Generally, there are 2 tests, microscopic tests to identify the semen and 2 microscopic tests to identify the blood. Now, first picture what you see is fluorescence test. Fluorescence test, semen contains choline, and in fluorescence test you can see dark brown rhombic crystals of choline iodide. Choline iodide, the reagent is potassium iodide. Okay. Number 2, Barbieri's test. Here, this test is also done to identify the semen. One of the presumptive tests, both fluorescence test and Barbieri's test are presumptive test for semen, where you can see yellow needle-shaped crystals of spermine picrate. The reagent is picric acid. These 2 tests for semen. Number 3, what you say is hemin crystal test. It is one of the confirmatory tests for blood, where you can see yellowish red to brownish black rhombic crystals under microscope. Number 4, you can see the feathery crystals, pink feathery crystals, that is Takayama's hemochromogen crystal test, that is another confirmatory test for blood. This already given in my Telegram group channel as well as my Instagram. You can go through all these extra topic. All the pictures I have given. Okay, you can go through that. You can join my Telegram group and you can get through all this. Okay. Now here picric acid reagent showed yellow needle shaped, that is Barbieri's test. Barbieri's test. Okay. Number 7. While playing, a child plucked a fruit from the plant and ate. Father brought the child to the hospital with complaints of drowsiness and hyperthermia. In this case, the poison and antidote is, first you have to identify. Now, they have given only 2 poisons, datura and yellow oleander. There is drowsiness and hyperthermia. Let me discuss on yellow oleander. First, yellow oleander is also known as Cerbera thievetia. You know very well, this is one of the cardiac poison which mainly acts on the heart and to certain extent on the spinal cord also. It gives rise to a yellow flower, that's why it is known as yellow oleander. Okay. All parts of the plant, including nectar, are poisonous. I told you it is mainly cardiac poison, to a certain extent spinal poison also. It also acts on the spinal cord. Okay. It gives rise to hyperkalemia and hypomagnesemia. Hyperkalemia and hypomagnesemia. There is no specific antidote for poisoning by Cerbera thievetia. Datura, deliriant poison. Normally we deal with 3 deliriant poison, most important. Number 1 datura, number 2 cocaine, number 3 cannabis, 4 and 5 like atropa belladonna and hyoscyamus niger. Okay. Datura, also known as thorn apple. Once it dries, once it opens, you can see more than 200-300 seeds. Other seeds mimics chili seeds. The active principles are hyoscine, hyoscyamin and traces of atropine. Traces of atropine. It gives rise to dilatation of the pupil and it suppresses the secretion of all the glands. It causes suppression of all the glands. Okay. It is known as road poison because it is used as a deliriant poison to rob people who is going on long distance journey. Okay. It causes dermatitis on contact, delirium, dilated pupils, dry hot skin. That is because of the suppression of the sweat. dry membranes, dryness of mouth and throat, dysarthria, dysphagia, decreased muscle coordination, drunken gait, drowsiness, dysuria, delusions, dreadful hallucinations, and finally death by respiratory failure. All 15 Ds. And here I give in red dry, hot skin and drowsiness, same thing asked in the question. A 35-year-old person comes to the casualty with history of consumption of some unknown seed. There are dilated people, dry mouth, decreased secretions. Asked in FMG June 21, answer is Datura. Meantime, it is also asked 2 years back in NEETPG 2021. Irritability, restlessness, confusion, inability to pass urine, means dysuria, hot skin, photophobia. Answer is Datura and physostigmine. Same related questions has been asked, drowsiness and hyperthermia. The antidote for Datura is maybe physostigmine, maybe pilocarpine, or maybe neostigmine. Trilodoxime is antidote for organophosphorus compound poisoning. Oximes, not for Datura. Okay. Number 8. After consuming some seed, a 45-year-old man presented to the emergency room with generalized muscular spasm and backward aching. The probable seed he had consumed is or. Datura, already I spoke. Datura does not give rise to backward arcing. All of you already know the answer. Anyway, for the purpose of discussion, let me discuss. Ricinus communis means castor plant. Castor plant, you can see it has got multiple soft thorns, not hard thorns like Datura. Okay. And inside the fruit, you get castor seed. And it contains active ingredient known as ricin, R-I-C-I-N, ricin. Ricin is a toxalbumin which causes hemolysis, agglutinin-agglutination reaction, and give rise to hemolysis. Abrus precatorius, here the main active principle is abrin. It also contains abrine and abralin, but main content is abrin, which is a toxalbumin, which also give rise to hemolysis, just like agglutinin-agglutination reaction. Okay, see the Datura seeds. It is also known as crab's eye, ratte, gunja, gunchi. Okay. Spinal excitatory poison, Strychnus noxomica. In Hindi, it is known as kuchila. Kuchila. Here, it has got some orange colored fruit. Once you open, you see the pulp. Inside the pulp, there will be few seeds known as Strychnus noxomica seeds, popularly known as dog buttons. Dog buttons because it was used to kill stray dogs. Okay. It acts on Renshaw cells in anterior horn in the spinal cord by inhibiting the neuroinhibitory enzyme glycine. Glycine is neuroinhibitory enzyme. When the inhibitory enzyme glycine is inhibited, person go for reflex excitation. All must go for spasm at the same time. All must go for spasm at the same time. In between the spasm, all the muscles are totally relaxed. All the muscles are totally relaxed. The convulsions are first clonic and later tonic. Clonic, tonic convulsions. But he'll be conscious till the end. He'll be conscious till the end. It gives rise to lockjaw known as trismus. Trismus, lockjaw. That is because of the spasm of the muscles of mastication, as you see in the picture. Meantime, remember, it is the late feature. Late feature. It does not seen in early stages of poisoning. Strychnine poisoning mimics tetanus. It mimics tetanus. Entire body may bend backwards like a bow, backward arcing, known as opisthotonus, backward bending, backward arcing. Now you see opisthotonus. Okay, sometimes it may bend forwards, known as emprosthotonus, or very rarely it may bend laterally, known as pleurosthotonus, lateral bending, pleurosthotonus. Okay, but most common is opisthotonus because it is most marked in anti-gravity muscles, Okay. After consuming some seeds, same question of course, the generalized muscular spasm and backward arcing, the answer is strychnus nux vomica. 9. A poor farmer with history of successive crop failure develop progressive spastic paresis, upper motor neuron signs, unstable gait. What is the toxin responsible? DOAA, aflatoxin, strychnine, ergotoxin. Already I mentioned about the strychnine. Strychnine did not give rise to paraparesis, give rise to generalized muscular spasm. Okay. Aflatoxin, it is a fungus which grown on groundnuts or maize or all similar seeds. It is a fungus. It is mainly hepatotoxic. Initially there will be nausea, vomiting, abdominal pain, convulsions, and other signs of acute liver injury. Long-term exposure may give rise to cirrhosis of the liver as well as hepatocellular carcinoma. And also there may be growth retardation in case of children. Okay, generally we don't deal with aflatoxin in forensic medicine. Okay. Ergot. Active principles are ergotamine, ergotoxin, and ergometrin. Ergotamine, ergotoxin, ergometrin. Generally, when the bread is prepared from cereals infested with claviceps purpura, it gives rise to a condition called ergotism. And in ergotism, mainly you should remember Saint Vitus dance, where it is associated with convulsions. At the same time, Saint Anthony fire, burning sensation, convulsions, and delirium. This ergotism, it affects both on vessels as well as nerves. Okay. I show you a picture where the cereals infested with claviceps purpura. Okay. Latirus sativus, also known as kesari dal. The poor people, especially during drought or in case of crop failure, instead of our regular dal, tur dal, they may consume kesari dal excessively, which contains an active principle beta oxalyl amino alanine, BOAA, which give rise to a condition called neurolathyrism, where it gives rise to spastic paraplegia or spastic quadriplegia. That is known as lathyrism or neurolathyrism. Look here, it has been asked Ames long back. A village was drought, surveying on the crops, weakness in the limbs and swaying gait, stiffness of his limbs, muscle tone was increased and ankle clonus jerk was brisk. Answer is Lathyrus sativus. So here progressive spastic paraparesis, upper motor neuron signs and unstable gait. Answer is BOAA. Coming to the number 10. The hyperthermia associated with the treatment of organophosphorus compounds poisoning with atropine and paraloxam is due to. This is not a very good question. Of course, aspiration, pneumonia also give rise to fever. And here I don't know exactly what exactly recalled by the student, whether it is acute case or bit subacute or chronic. But remember, about 25% of the cases, atropine toxicity gave rise to hyperthermia. Hyperthermia. And here they are not mentioned any other signs like crepitations or pulmonary edema or whatever it is. They just mentioned only hyperthermia. So I feel best answer here is atropine toxicity. Suppose if at all they ask the hyperthermia along with the crepitations and bronchi, then the answer is aspiration pneumonia. But here only hyperthermia. So best answer what I feel is atropine toxicity. Number 11. A chronic alcoholic patient develops confusion, ophthalmoplegia and ataxia. What is the diagnosis? Generally, we deal with 4 different psychiatric manifestations in case of chronic alcoholism. Even psychiatry also, it is overlapping. One is delirium tremens. A chronic alcoholic, when he suddenly stop intake of alcohol, or if he suffer from fracture of a long bone, or if he is exposed to excessive cold, hypothermia, or if he is exposed to some infections, then it may precipitate delirium tremens. It also may give rise to a condition called Korsakoff psychosis. In Korsakoff psychosis, the main feature is confabulation. Confabulation. Okay. Marchia-Fava-Bignami disease. And number 4, Wernicke's encephalopathy. Wernicke's encephalopathy. Already I mentioned about delirium tremens. There will be delirium along with. Already I told the reasons, the withdrawal of alcohol, such things. Korsakoff psychosis, already I told it is usually associated with confabulation. Loss of memory, pathological loss of memory, where the person fills the gap with imaginary events. Marchia-Fava-Bignami disease, that is degeneration of corpus callosum. Degeneration of corpus callosum. Wernicke's encephalopathy, that is a popular mnemonic right from 30 to 40 years. Goa P. G for global confusion. Global confusion. O. Ophthalmoplegia. A. Ataxia. And P. Peripheral neuropathy. Wernicke's encephalopathy. Of course, Wernicke's encephalopathy also later eventually ends in Korsakoff psychosis. Okay. Now, already you got the answer, Wernicke's encephalopathy. Number 12. In case of aspirin poisoning of 100 tablets, which treatment modality is useful? Aspirin poisoning. Of course, this may be a medicine question or a pharmacology question, but we also deal with aspirin. N-acetylcysteine is antidote for paracetamol. Flumazenil is antidote for tranquilizers like diazepam. Gastric lavage, normally we don't use sodium bicarbonate. Gastric lavage, most commonly we use regular water or potassium permanganate in case of oxidizing poison. But you know very well, always we teach in case of salicylates and barbiturates, ideal modality, treatment modality is alkaline diuresis by sodium bicarbonate. Alkaline diuresis. Aspirin is acetyl salicylic acid. Okay, the answer is alkaline diuresis by IV sodium bicarbonate. A farmer while sleeping in his agricultural field felt some prick, woke up and saw something moving away. He presented to the emergency room with pain at the bite site, edema and blisters and uncontrollable bleeding. I really don't know what is the meaning of uncontrollable bleeding. Uncontrollable bleeding normally we say in case of any incision on a particular artery. Say for example, rail artery is cut, uncontrollable bleeding may be there. Normally we don't see uncontrollable bleeding in case of scorpion sting or viper bite or cobra bite or wasp sting. Let me explain. Snakes in India, generally we divide under 3 headings: elapids, vipers and sea snakes. Elapids examples are common cobra and common crate. Vipers, Russell's viper and saw scale viper. Elapids are always neurotoxic. Vipers are always hemotoxic or vascular toxic. Sea snakes are muscular toxic or myotoxic. In case of elapid, because it is neurotoxic, death is due to respiratory failure, paralysis of the respiratory muscles. Viper, circulatory collapse or circulatory failure. Muscular toxic, again because of the paralysis of the muscle or respiration, person dies of respiratory failure. Okay. Now, in case of snake, local signs are almost nil in case of common crate, almost nil in case of common crate. Okay. But in case of viper, it is maximum. Maximum. Okay. Look here. Local size. Common crate almost nil, especially common crate is very minimal. Next is common cobra. We can see the triple response with some fang marks. Sometimes in common crate you don't see even fang marks, some scratches may be there. Vipers, it is maximum because it is vascular toxic. Hemolysis takes place, bleeding may take place. Okay. Convulsions are maximum in case of common cobra, most common in common cobra, nil in vipers because it is not a neurotoxic. Okay, just remember. Now, scorpion. Scorpion venom is neurotoxic, hemotoxic, cardiotoxic. Most common neurotoxic, predominantly neurotoxic, otherwise it is all three. See, one more point I would like to tell. Potency wise, the most potent venom is jellyfish. Next to jellyfish is scorpion. Scorpion venom is more potent than any other snake. Out of all the snakes, most potent venom is common crate, but scorpion venom is more potent than common crate. But injected dose is very less. Death in case of scorpion sting is very rare in adults. Sometimes children may die. Okay. Now, cardiotoxic, it may give rise to delayed toxic myocarditis. Delayed toxic myocarditis. That's why in case of scorpion sting, you have to admit the patient at least for 24 hours for observation. Okay. Now, coming back here. Now, cobra bite, of course, you can rule out. Wasp sting, you can rule out. Problem is between scorpion and viper. But what I say is, even though scorpion venom is vascular toxic, injected dose is very less. And there is edema and blisters and uncontrollable bleeding. So, best answer is viper bite. Viper bite is the best answer. You understood? That is regarding discussion on recall questions in FMT in NEET 2023. Wish you all the best. Bye-bye.